experiencing something so traumatic and life-altering as chronic pancreatitis, I believe part of my healing process has come by sharing my story and bringing awareness to this often misunderstood, debilitating disease. My journey started early 2015 with my first trip to the ER. Although I had experienced vague symptoms years before, they were just that, vague and inconsistent. I had dealt with random morning nausea that appeared soon after the birth of my second child that was attributed to birth control pills that I was taking at the time. I had dealt with fatigue and occasional feeling of being run down, but let's be honest, what mom of 2 small children isn't always run down? So that would not have sent a red flag. This one morning was different. I woke up with this crushing pressure, and it felt as though I had an elephant sitting on my chest. I was concerned that this could possibly be a heart attack, so off to the ER to get checked out we went. After an x-ray of my chest and routine blood work came back normal, I was given a full cardiac exam. Thankfully, it was normal. I was not admitted, but sent home with the conclusion that it was most likely stress-related. Unfortunately, I had never heard of pancreatitis at the time, and even if I had, based on my symptoms, I would have never made the connection. The following week, I made an appointment with a primary care physician who ordered an ultrasound of my abdomen and additional blood work. The results were normal as well. The feeling of pressure continued for weeks, and although not severe, the pain was always present. Then a new symptom of back pain appeared. And at the time, I didn't have much of an appetite, but I could eat, and the pain neither decreased or increased. But the nausea was still there, and I felt like I had the flu. I returned to my primary care doctor, who continued to investigate my symptoms with an addition of an MRI and a CT scan of both my spine and abdomen. And because all of these tests were normal, I was diagnosed with possible IBS, then depression, and then maybe anxiety. The IBS diagnosis did not fit, but I was certainly becoming anxious and depressed from the lack of answers as to why and where this pain was coming from. It was very difficult to explain to anyone, let alone a doctor, that I had this pain that wouldn't go away and was affecting my quality of life. A pain they couldn't see and didn't appear on their tests. I feared being told that it was psychological. However, I knew this was not in my head. I began to do my own research, and I did what most doctors hate to hear. I Googled my symptoms. There were many digestive disorders and diseases that came up. However, pancreatitis, and more importantly, chronic pancreatitis, was at the top of that list. But not all of the pieces of the puzzle fit. How could all my tests be normal? And surely, if something is serious of pancreatitis, it would show somewhere on a test. On paper, I looked healthy. On the outside, I did not look sick, but inside I was fighting a war. Over the next 6 months, I saw many doctors, all with a different diagnosis of what it could be. A few had concluded it was psychological, while some concluded I was simply drug seeking. I can't begin to express how frustrating and frightening it is to be sick and getting sicker without answers. And without answers, without a cause. I knew in my heart it was chronic pancreatitis, but because there was no evidence other than the symptoms, I was told it was nearly impossible, as it is a rare condition, and because I had no prior medical history, that if it was pancreatitis, they would certainly write a medical journal on my case. But still, I was left with no answers. Finally, I had an endoscopic ultrasound, which showed no damage or inflammation to the pancreas. However, 2 tiny cysts were seen. These were deemed insignificant and probably congenital. So I tried my best to live with this gnawing, persistent pain, hoping it would just go away on its own. So I attempted to get relief from acupuncture, from a chiropractor, from meditation. I took vitamins, I cut out fats, and I ate mostly vegetables. Nothing helped. By the end of 2015, I was exhausted from the chronic pain, I was exhausted from the weight loss, and from the malnutrition, and becoming financially exhausted. By the end, I spent my days reading articles on pancreatitis and chronic pancreatitis, and had found on Facebook a support group for CP sufferers, and was surprised to find my story was not uncommon, that many had gone years before getting diagnosed. Many had normal test results and had been labeled drug seekers when asking for this invisible, debilitating pain to be managed. And through this group, I also discovered a possible treatment, one that would remove the whole pancreas and with it, a gnawing pain. The TPAIT surgery would also transplant the patient's insulin-producing cells into their liver, hoping to minimize diabetes. I was fortunate enough to speak to others who had the procedure and were now living pancreas-free, productive lives. The challenge, of course, was getting diagnosed. After finding out about 2 doctors in Washington, D.C. who were having success diagnosing early minimal change chronic pancreatitis, I took a big risk and flew to Washington to meet them. After examining my medical files and comparing their MRCP of my pancreas to the one performed the previous year, not only were there 2 cysts previously seen, but I had multiple cysts that had formed along the duct. I was finally given the diagnosis of chronic pancreatitis. That is a moment me or my family will never forget. I was overcome with this feeling of relief and fear. I finally had a diagnosis, a name to what I felt was there all along, but I also knew this was an incurable disease. It was recommended that all options should be explored before entertaining the option of the TPAT surgery, and a pain blocker stenting procedure might provide relief or at least delay the inevitable. Both were tried, and both unfortunately failed. My last effort was pain management. Over several months, I was given various strong doses of opioids, which provided enough relief that I was able to eat a few bites of a meal a day. Enough to sustain me, but not enough to keep from losing weight. I could feel my body giving up the fight. I was struggling to maintain 100 pounds, and I was bedridden. I knew my only hope was this massive surgery. I contacted Baylor Hospital in Dallas, and it was arranged for me to meet the transplant team. Their evaluation concluded with findings from their EUS, a collapsed duct that was nearly impossible to see on standard imaging, essentially a needle in a haystack. They quickly approved me for the TPAT, and I was scheduled a month later for a 13-hour surgery. No one can prepare you or your family for how you feel and look when you first wake up. I was now a diabetic. I had a feeding tube, a drain tube, a central line, monitors, and an incision that extended from my breastbone to my belly button. And I had post-surgical pain that felt like my insides were ripped apart. But even through that pain, I could tell the pancreas pain was gone. The team harvested over 400,000 islets, and by all accounts, my surgery was a success. Even though I did not have any post-surgery complications, recovery was long and hard, and often felt like every step gained were 3 lost. It took 3 months to be able to eat enough to maintain my weight and to remove my feeding tube. Almost a year to gain back 20 of the 30 pounds I lost. And amazingly enough, a year and a half later, my islets gave me the greatest gift of all. They woke up and started to do an amazing job in their new home. Almost 3 years since surgery, and my A1C is 5.9. Pretty incredible considering I don't have a pancreas. Although the creon I take to help my body digest my food works well, gaining and maintaining weight continues to be a challenge. But according to my blood work, there's currently no or little signs of vitamin deficiencies. I was so grateful that this surgery was an option. It was not a cure. And with a new digestive system and now diabetic, there will be future challenges or health issues as a result. My case is far from typical, as I had never been diagnosed with pancreatitis, no prior medical history other than giving birth to my two beautiful girls, no history of alcoholism, and I never took medication. However, I listened to a voice inside that said, "Don't give up," and I stayed persistent in searching for answers. I was fortunate enough to have an amazing support system of friends and family, and through the pancreas support groups and groups like the NPF, I did not feel alone in my fight. I had hope. My hope continues with the opportunity to help others who find themselves in the same or similar situation that I have experienced. I am thankful to be given the opportunity to participate today, and in the future, I hope to speak to both professionals and patients alike of the importance of bringing awareness to this elusive disease and the struggle to find better treatments and ultimately a cure. Thank you.